Hi there. There you are. I'm Betsy, the nurse practitioner. Can I get you to confirm your birthday for me? That's what I got. And then I was looking through the waivers you filled out. Saw that you're having a lot of fatigue, weight gain, decreased strength, joint pain, and that you're on testosterone now, but you're only getting a dose every 2 weeks, correct? So you feel good for maybe 1 week? All right. How long have you been on it? Okay. How many days out from it? Yeah, I am, yeah. Thanks for recognizing. Yeah, sniping some noobs. How many days out from a shot were you when you had this blood work done? Okay. And do you donate blood? If so, how frequently? Okay. And then what's your height and weight? Okay. And your blood pressure? Oh, what is it after you take your medicine? Okay, good. And do you know your resting heart rate? Very good. And then no drug allergies. And you're married. Do you have any biological children? Okay, and you're done? Yeah. And what kind of work do you do? Hey, I'm in South Florida. Some of you guys are just starting. And what kind of work do you do? A lot of hats to wear. What's your device? A vein finder? Yeah. That's fun. Yeah. All right. And then any underlying health issues? Sounds like you have a history of high blood pressure. And okay. What and what's your blood pressure medicine that you take? Okay, the hydrochlorothiazide. And then any vitamins or supplements that you take regularly? Okay. And then we're doing high protein, working out twice a week. How many drinks with caffeine do you have a day? Mm. Yeah, sounds like it. Oh no. And then any snoring or sleep apnea? Mm. Okay. All right. And let's see, any surgeries, hospitalizations, head injuries, TBI, concussion. And then let's see, any history of anabolic or black market steroids? All right. Any family illnesses with your mom, dad, siblings? Anyone had to take medication regularly or any cancer? Okay. And when was your last checkup with your primary care provider? Okay. And then are they doing prostate exams on you? The blood. What about colonoscopy or Cologuard? You're due. And then, yes. Anything lumpy, bumpy, tender over the thyroid, chest, nipple sensitivity, tummy tenderness, change in the urine stream? Very good. All right, so next we're going to go through the blood work, talk about different recommendations. I'm going to email you all the recommendations as well as to your patient coordinator, Mike Arrow. His phone number will be towards the bottom of the email. You could text him, call him, email him, let him know what you want to move forward with. If he doesn't hear from you, he'll reach out to you. And then you'll have my email too, the office number. You won't be short of resources. So, your blood sugar for the past 3 months, little elevated, putting you in that pre-diabetic category. Obviously, diet and exercise. But we do have a couple medications for that. We have metformin, we've got the semaglutide, we have the tirzepatide. I'll put that in your email. Those are options for you. Kidneys look great, liver great, B12 great, vitamin D not good. That's pretty common though. You'll either want to take at least 5,000 IUs a day. We do have injectable vitamin D. It's oil-based, so you could put it in the same syringe as testosterone, knock it out together if that makes it easier for you. Your cholesterol, not ideal, a little elevated. Obviously, diet and exercise. Red yeast rice with coenzyme Q10 is a good supplement to bring that down also. I'll put that at red yeast rice with coenzyme Q10, and I'll put that in your email also. Thyroid numbers looking good, prostate's looking good, cortisol's looking good, your insulin-like growth factor reflecting your growth hormone production, you're at 93, the range for your age 81 to 263, so on that lower end of normal, but within normal limits. We do have a lot of, yeah, that's all right. Sleeping can help that a lot. But we do have a lot of peptides available. Some of them do increase your growth hormone secretion, which can help with muscle development, recovery, body composition, cognitive improvement, sleep quality. There's other peptides specific for weight loss, sexual health, cognitive improvement, healing, anti-aging. I'll put the whole list in there. I'll highlight you wanted to lose weight and the healing ones. I'll highlight the weight loss and healing for you. Weight loss, healing. And then let's see, your testosterone on the lower end. So we're happy to transfer that over to us. We're going to increase the frequency to weekly. or we'll add an estrogen blocker to prevent your body from converting the testosterone to estrogen. And we're going to add a testicular function medication to improve your body's natural production of testosterone, preventing significant testicular shrinkage, preserving ejaculation volume. If you're already having testicular shrinkage, we might want to increase the frequency of that initially. Is that the case for you? Is that bothering you? All right. Well, it's not going to get worse than it is now. Your DHEA sulfate, that is a building block for your hormones. You're at 110, range for your age 71 to 375. So if you want to get that a boost, 25 milligrams a day of DHEA, that's going to help support the hormones, help with your energy, mood, sex drive. Let's see, estradiol, that looks okay. Sex hormone binding looks okay. Insulin's elevated, but that's going back to that pre-diabetes, developing some insulin resistance. You may want to increase your resistance training too, because those muscles like to suck up that sugar. Blood count on the higher end with that hematocrit is a little elevated. That could also be related to dehydration, but you are donating regularly. Continue to do so. All right, well, make sure you replenish those fluids. Yeah. The sleep apnea can also contribute to that, because if your oxygen levels are dropping at night, those red blood cells are carrying oxygen. So your body's going to try and do something to stay alive, right? So try your little guy out. Iron on the lower end of normal. Sometimes that frequent donation, even though you're trying to manage the red blood cells, can drive the iron down. So try and make sure you're eating iron-rich foods. Maybe right after the donation for like 2 weeks, you may want to take an iron supplement. The prolactin, that's a hormone from the pituitary gland, looking good. Ferritin looking good too. So in that email, watch those sugars in the A1C, vitamin D, cholesterol, transferring your hormone replacement therapy, DHEA, and then the peptide list, and I'll highlight the weight loss and the healing stuff. Any questions, comments, concerns? All right. Probably that week that you're feeling good, and then nothing on the week you're feeling bad. All right, so I'm going to send that to you. If you don't see my email within an hour, it's probably sitting in your spam. You can always email me back if you have any questions, but Mike's going to be a great resource for you too, and you'll have his cell phone, his email, his address. I'm not going to have his address, but you'll be able to get a hold of him. All right. Well, I hope you have a good weekend. I'll try. Oh, well, my weekend's certainly not going to be as good as yours. Enjoy. Be safe. Okay, take care. Bye-bye.